Bulbinaka, I know we don't make these announcements at the same time every day. I wish we could. But the nature of 24 testing means that new developments can come about at a moment's notice. And when that happens, rather than rush to meet an announcement deadline, we get all the information, sort out our strategy, and then we announce the changes that we have made to the public. We considered setting a cut-off time for receiving new information and scheduling all the press conferences at a set time every day. But unfortunately, COVID doesn't have a cut-off time. If that's how we try to manage things, we would end up confirming a new case in the afternoon, but not announce it on that same day. And Fiji is a small place. We know from experience that even the slightest possibility of a new case can spark rumors and misinformation quite quickly. So to stay ahead of coconut wireless, or what I call the media coconut wireless, we try very hard to keep you informed of the latest developments as soon as we can with verified information. We will continue to review this strategy. In the meantime, we appreciate you taking the time to tune in and to be with us, even if it may be at different hours of the afternoon. Today we have no new cases of COVID-19 to report, but we have some important updates to share with you with regards to our existing cases. Following confirmation that 2 doctors at the Lotoko Hospital tested positive for COVID-19, we launched an immediate and intensive contact tracing exercise. These 2 doctors work closely together, so we're quite sure one passed the virus to the other. But individually, they both came into contact with many others. So far, 98 has been identified. Many of these contacts, unsurprisingly, are their colleagues who work in Lotoko Hospital, including doctors and nurses. As per protocol, these Fijians must be entered into 2 weeks of quarantine. This has seriously affected our staffing capacity, particularly for the medical and surgical services. We have redeployed staff from other facilities to cover these gaps. But needless to say, it will be a very demanding 2 weeks of shift for the staff at Lotoko Hospital. Still, we are confident that we can manage. Some of our other contacts are patients. Given that they were seeking treatment for other ailments, we have identified these individuals as particularly high risk. All have been identified, swabbed, and entered into quarantine. Neither doctor had been directly linked to other existing cases of COVID-19. But our investigation is still in its early phase, and we are not ruling out anything. As a result, we are also testing all the staff of the COVID-19 isolation ward in Lotoka. I mentioned yesterday that both doctors had Care Fiji installed and kept it running. We thank God they did. So far, we have identified 20 close contacts through the app. We found these contacts very quickly. We did not need to publish lists of times or location online to do so. Instead, the app provided that information in a matter of minutes after the doctors uploaded their Care Fiji information. Some of these contacts may never have, or would never have been identified through traditional contact tracing means, which, as I've mentioned before, relies mainly on patients' memory. You ask any lawyer, police officer, or judge, and they will tell you memory is an imperfect tool. People forget things all the time, and Care Fiji does not forget. As long as everyone has the app installed and keeps the Bluetooth turned on, it tells us exactly who has been near someone living with COVID-19. By providing us with the information quickly, the app does more than save time, energy, and resources for my teams. It saves Fijian lives. During past conferences, I've been asked, or I've taken plenty of queries from the media about Care Fiji. I think it's fair to say that there was an air of skepticism around some of the questions. I understand that skepticism is something of a trademark with many of us. That's all good and that's all well and good. And I hope that the proven success of this app finds its way into your reporting. I hope you will help us encourage more downloads of the app. Ensure that the phone's Bluetooth is turned on to make our contact tracing as effective, as efficient as we saw in this case. And I hope you'll join us in crediting Digital Fiji team for this app's development. My teams are already extremely experienced contact tracers. They're a model to other nations. The widespread adoption of Care Fiji simply takes them to another level of effectiveness and efficiency. The thoroughness of our contact tracing means that the ministry has never needed to publish any names of any of our patients. Sometimes patients choose to share their COVID positive status, but doing so is just that, a personal choice. So please stop asking us about the personal details of any patient. We will never give them. Physician-patient privilege is sacred and we will not violate it. That is my answer today, it will be my answer tomorrow and every other day after. I raised this issue because yesterday the media insisted on asking about the personal details of some recently discharged patients. Not long after, the identities of 2 doctors who tested positive for COVID-19 was leaked on the social media. Their personal choice to reveal their status was taken from them, and it has impacted them quite badly. It's good that they have plenty of friends around who have called them and consoled them throughout the night. Otherwise, they were very depressed. Those who are sharing their identity should stop. I know that preventing information about a person being shared on social media is akin to trying to stop the tides with a broom. But that doesn't mean I won't try. I want to appeal to people to think twice before they share this sort of private information. It reflects poorly on your values and your respect for your fellow Fijian. The question you should ask yourself is, would you like your personal information shared if you or one of your loved ones contacted the coronavirus? The sharing of private and confidential information does real damage to the COVID-19 patients who truly do not need any more stress in their lives than the one that they are going through at that time. We can do better, Fiji, and we should. Lautoka has existed as a containment area now for 16 days. And today is day 9 after the recent reset. I know life in Lautoka is nowhere near normal. These latest cases do mean that the containment area may last for some time longer. So far, our contact tracing stemming from these cases is progressing well, and we will make an epidemiological assessment of the cases to determine whether the containment area protocols should continue, and if so, for how long. But we cannot make that determination at this stage. I will let you know as soon as we can. I want to say a word about our isolation facilities. Every day our doctors and nurses and healthcare officials leave their homes and head to work knowing that we face risks to our own health and well-being. Not only from COVID, but from any other of the many infections and diseases that we treat in the course of caring for patients. So it is no surprise that throughout the pandemic, healthcare staff serving in the front lines have faced the greatest risk of exposure to coronavirus. In Fiji and in clinics, surgery, theatres and ICUs worldwide, healthcare workers work in close proximity with COVID-19 positive patients. We wear the proper PPE, but the risk of infection is always present. If we do happen to contract COVID, we don't play by a different set of rules. We go into the same isolation wards as everybody else, the same wards that our colleagues are responsible for managing. So when it comes to these facilities, please trust, we care deeply about seeing them run well. We know it could be us, someone we love, or any of our fellow citizens, all of whom we are sworn to care for, who are in those facilities. And given that we are in the business of saving lives, please trust that these facilities are equipped to offer the best possible care to those who may develop a severe case of the virus. And if you do have COVID, I want to emphasize again that there is no safer place for you to be than in our isolation facilities. When I can, I'd like to end with some announcements that have some positive news. First, we'll be adding 4 new gene expert testing machines to our capacity. Adding to the additional machine that was donated by Oceania Hospitals, that will boost our testing capacity by about 480 tests per day. So essentially, we had one machine that was donated to us by Oceania Hospitals, and then we had 4 more that has been donated after that. We've been shattering our daily testing records nearly every day. With these machines at our disposal, we expect that streak to continue. I am also happy to report that as of today, our teams have administered all 4,000 COVID-19 vaccine doses allocated for Suva. That deployment went off without a hitch, as high-risk individuals, including the elderly, more frontline healthcare workers, bankers, taxi, minibus, and bus drivers came forward to be protected. Oh, yes, and including some of the journalists. I'll remind everyone, getting 1 dose does not mean that you are vaccinated. It takes 2 on a 10 to 12-week timeline. No one in Fiji is fully vaccinated at present. All of us must practice strict adherence to our health protection measures until such time that we achieve the full immunity of our eligible population. We expect to roll out the remaining 20,000 doses through the West by the end of this week. The day we are able to roll out these vaccines everywhere in Fiji into the arms of every eligible Fijian is the day that lockdowns like the ones we have endured here in Suva become all but unnecessary. More doses are on the way, so please register online. Come forward when you have a chance and help us take Fiji into a post-pandemic future that has already been embraced by the rest of the world. Thank you.
Thank you. So as just announced by the Permanent Secretary, we have 0 new cases to report. In addition, we can announce that there have been 7 recoveries, leaving 44 active cases currently admitted in isolation. I'll have more details tomorrow for you about how many border quarantine cases versus locally transmitted cases that leaves in isolation now. So Fiji has had 121 cases in total, now with 75 recoveries and 2 deaths, since our first case was detected on March the 19th of 2020. A total of 56,266 COVID-19 tests have been conducted, and our daily average of testing is at now 1,084 tests per day over the last 7 days, and a weekly average of 5,995 tests per week. And our as mentioned, we have a record of 6,821 tests that were conducted last week. Yesterday, we conducted 1,278 tests. Our overall test positivity remains at 0.2%, and our 7-day average daily test positivity remains again at 0.4%. Thank you.
Thank you, PS and Dr. Alicia. Ladies and gentlemen, again, just reiterating some messages that have been delivered earlier. Our screening clinic continues in full swing throughout the country. Our stationary screening clinics have increased from 55 to 58. So we have set up 3 new screening clinics, stationary screening clinics in Vunsea in Kandavu, in Rutuma, and in Lomoloma in Vunumbalabu. And we are again encouraging members of the public to present to these clinics if you have symptoms or you're worried about the possibility of having the diseases. The last 24 hours, we screened 2,453 Fijians and 357 were swabbed, and the cumulative total of those screened so far is about 30,325 Fijians, with 5,636 swabbed for the disease. Our mobile community screening program continues in the areas of Nandi, Ra, Nitasiri, Tailebu, and Asinu. In the last 24 hours, this sweep continued and screened 10,632 Fijians, and 370 of those were swabbed. So our total cumulative total to date is 229,129 Fijians screened and 5,865 swabbed for the disease. Our targeted mass screening also continues in the areas of isolation, confinement or containment that we've talked about earlier. Nandali, Walelevu, Tikino Saibo, in Dongotuki, in Donganabatu, in Nanuklo and Serlangi, as well as in Naria, and this is progressing steadily. The effort was boosted yesterday with additional 70 military and police personnel, and we are very sure that the screening program will be boosted and will pick up pace in the Ra province. As an update, we have contacted and screened all members of the Lionheart Rugby Sevens team, who we talked about in the last 24 hours. And we've contacted them, and they've come on board and have been screened. So we thank these young Fijian gentlemen for cooperating with our team to ensuring that our contact tracing program continues. 13 community isolation facilities currently exist throughout the country with about 523 bed capacity. 62 of the beds, or 12% occupancy rate, currently exist. This is manned by Ministry of Health staff and members of our military forces, and it houses positive cases in this particular facility. So obviously, as the name dictates, this area is out of bounds for members of the public. As mentioned by the PS earlier, we also do have some 270 or so contacts who are currently in housed in our vacant quarantine facilities in Nandi, and they are going through our normal SOP for screening of contacts to identify whether they have the virus or not. In addition, we have 352 repat Fijians who are currently undergoing the quarantine process, 14 days mandatory quarantine, and consecutive tests. And we have full confidence in our team at the quarantine facility that they'll look after this, the repat Fijians, and take them through and make sure they come out okay on the other side. In conclusion, as stated by PS, Lautoka Hospital remains operational. They continue to deliver all emergency services that they've been delivering prior to the incident. And the new medical team, the replacement medical team, is on board, and they are delivering the services as we speak. So again, we are encouraging all the members of the public in Lautoka and in the Western Division not to worry. If they have sickness, they have disease, they need to go to the hospital. Lautoka Hospital is still your place to be seen and treated for your disease. Thank you very much.
Thank you, Dr. Tundrabu. Thank you, Fong, Dr. Alicia, members of the media. We now open to questions. Please step forward, the organization, the name, and also make sure that you remove your mask.
Thank you. Dr. Fong Eva from Legend FM and Fiji Village News. Can you confirm whether the ministry have established if there were any breaches of COVID-19 guidelines that was done by the 2 doctors that contracted the virus? And have you established the source?
As I mentioned, they never worked in any of the COVID-19 wards. They did not work there. We still have to investigate So that's what I mentioned, that we are testing everybody who work, the people who are guarding the COVID-19 area, we're testing them also. Okay, so those who are working, the staff that are inside the ward, we're testing to see if there's any positive ones, and then we will see whether there's a link from that one to the doctors. There's a way of doing it. We do have the science that can back us up to genomically sequence that line of investigation. We also are open to the possibility that it could be from the quarantine facility, it could be from the funeral. You know, we have to be open to all possibilities. But that line of thought is already in our mind. Thank you.
Dr. Fong from the Fiji Sun. Can you speak about the ministry's ability to conduct antibody tests for those who may have unknowingly contracted the virus and recovered from it?
Okay, so for diagnosing COVID-19, we use PCR tests. These tests actually, the test looks for the presence of the virus, the genetic material of the virus. And what the test indicates, particularly a particular reading of the test, is that you have that virus in you right now. Now, sometimes we get readings that are quite, indicate a very low level of the virus. It could indicate that you're either very early in your disease or you're very late in your disease. We know that's happened where someone has tested positive for COVID months ago and they're still testing positive now and they have no symptoms. So we know that that happens with the test for the virus itself. What you're talking about is the antibody test. With the antibody test, it tests to see if your body has had a reaction in the past to the virus. So it's testing for your own antibodies, your immune system soldiers, because if they've been activated, it's likely that you've been exposed to the virus in the past. So what it is not, it's not a test for acute infection. It won't tell you that you have the virus right now. What we also know about some of these tests is that it's called a rapid test. So it's done, it's a very quick test to do. There's differing levels of efficacy of these tests. So sometimes you can get a false positive with this test. So someone who's tested positive on the test might not have had exposure to the virus, but for some reason they're testing positive. So for all of these reasons, we don't use it as a means to diagnose someone with COVID-19. It may have applications in the future. For example, if we want to see if someone has tested positive months before and they're still testing positive now, we might be able to use a test to say, okay, they're probably immune to it, we might not need to isolate them. But these are all things that our task force looks at and decides upon and puts into our guidelines. And so far, that's not something that we have done, particularly because we've been a COVID-contained country for so long that we have a need to go that route. But essentially what I'm saying is that in our current response to this outbreak, we've seen that antibody tests will likely not give us much value compared to the testing that we are doing right now. Thank you.
Dr. Fong, Litya Rava from the Fiji Times. So I'm just after the status of the COVID-19 patient. As you mentioned that not anyone in Fiji is fully vaccinated, but would you be able to tell us just in terms of the reaction and recoveries of those patients that have received their first jabs and those that have not?
We actually haven't. I know where you're coming from. You're wondering. Oh, sorry. You're wondering whether the vaccine helps some people to recover. Okay. It actually, that's not the role of the vaccine.
No.
Yeah, the vaccine actually prevents you from getting sick. Yeah. Not so much the recovery part. That's one part. And as I know, like we discussed the last time, for the vaccine to be useful, it actually needs 2 doses, 10 to 12 weeks apart. So we haven't, seen the need for us to actually assess that question. Like we got plenty data that we have to assess, and that probably is not a line of scientific inquiry at the moment. But I assure you, if we do see the need for it to happen, especially when we start vaccinating a lot more people and we get 2 doses, we will probably seriously consider your question and give it some thought as to, just to be able to reassure people that things are working.
Maybe encourage them to come forward and take the vaccines, because some people are still reluctant at the moment.
Oh, I see. So you are hoping that if we can demonstrate that it actually prevents people from getting very sick, they just get a little bit, they test positive but they don't get sick, that would be a good way of promoting the vaccine. I agree with you, but I also right now, the vaccine is in all the places that we put it, the amount of people that are going for it is huge. The people have come to understand that it has a useful part of the post-pandemic world, and we all want to be part of the post-pandemic world. So, but as I said, your question might come up later in the future. But at this point in time, we still not going to go down that road.
So just my follow-up question, just on the recoveries. You mentioned it's 7, and you also said that you won't be able to reveal the identity of the patients. But would you be able just to tell us if those are border quarantine cases or local?
So as I mentioned in my statement, I don't have that information today, but it'll be updated in tomorrow's press conference. So as you know, yesterday we had 51 active cases, and now the updated information we have is that we've had 7 recoveries. So that's brought down our active cases in isolation to 44. So tomorrow I'll be able to break it down for you about how many of those 44 now are border quarantine versus locally transmitted cases.
Dr. Fong, I'm Shinal Charan from Fiji Village. Dr. Fong, it has been noticed and also highlighted by Minister for Housing that children are still moving around and people are drinking grog in groups from different households in informal settlements and PRB flats like the ones in Mead Road. What measures are being taken for informal settlements and PRB flats, and will police be engaged to check on these areas so that guidelines are followed and action is taken?
Yes, I understand your concern, and I would understand the concern that comes out of those type of cases, because if everybody else is protecting themselves and a significant proportion of the country is not protecting itself, and that puts everybody else at danger. Okay. We have asked police to be on the watch out for these type of things, and they have actually been some cases where they've been able to sort it out, where they've been able to deal with people who are drinking yangona and getting together in gatherings that are not supposed to happen. I suspect that we will not be able to get every single gathering, and I presume that there must be ways and means in which people can gather without our noticing or being able to see. One of the other areas of discussion at the moment is that those kind of vulnerable populations, the ones that are living so close together that gathering cannot be, we are hoping that we will also be able to target them a lot when we do our vaccination, because they are quite vulnerable in that respect, that they live they're in poor neighborhoods. So we've been talking about various discussion about how can we probably get to them. Maybe we get through employers, especially government workers. If they stay a lot there, then we might be able to vaccinate government workers and family. That might be one access point. We are thinking of a lot of different ways, but at this point in time, for us to go down and virtually keep an eye on them and police them more strictly would probably be not a very good use of all our resources. Thanks.
Dr. Fong, Marioni from Fiji One. Does the ministry have any leads on the Ara community case?
Not yet. We have had some discussions, and probably we'll throw some light into that tomorrow. I don't want to give you any half truths. Because you know what happens to half truth. They get taken as full truth and then we can't pull it back. So tomorrow we probably might have something.
Okay, just a follow-up question. Sir. Apart from the 44 active cases, how many more in isolation and are considered high risk?
I'm not sure what you mean by high risk, but if you mean people who are very sick, so as Dr. Fong mentioned yesterday, we're thankful that so far none of them have severe COVID-19.
Dr. Fong, good afternoon. I'm Cristiano from FBC News. So given the theory of how the B1617 variant entered the country theoretically through the luggage of a couple who returned from India, and given that the ministry has yet to establish the recent case in Lautoka and how they got the virus, has the ministry contemplated closing down Lautoka Hospital? And also a follow-up question to that, if your investigation leads you to a necessary decision to close down the hospital, what contingency plans are in place to cater for the citizen in the Western Division?
Yes, I think you've answered the question. We do need to get more information. And I did mention in the press conference today earlier on that Lautoka is possible that we may have to extend our lockdown. It's possible that we may have to deal with the Lautoka Hospital in a more stringent measure. Everything is based on the information we're getting. But like I told you, we've got informants who know how to give an history, number one. Number two, we got informants who had the Care Fiji app on. And based on that Care Fiji app on, we were able to contain very quickly another 20. Okay? That's without them asking. And then after the rest, people who just came forward, people who we think might have contacted them even if they didn't notice it. You know, so that we ended up with so far around 98 or close to 100 that we have pulled in. And the numbers may have gone up further as of this afternoon. So once we get information out of that group, especially the close contacts, we will be able to understand what we call the epidemiology of the spread. You know, whether the spread itself requires an imminent close down. We try our best to only ask for lockdown. The severest lockdown we've ever had was the one in Suva. And you can understand, because 877 people in a garment factory, we didn't know any history. It was very hard to get the history. They were not very good informants. None of them had the Care Fiji app on. So, lockdown. But this, we're talking about some very good informants who also had the Care Fiji app on. So we might be able to target our lockdown more clearly only on the context of them and not have to close the service. But yes, if we have to, it will be done. We do have our own contingency measures in place. We have a number of other facilities that we can pull up into to provide the services that we don't have that we have at Lautoka. We have in the past deployed teams to Singatoka. Singatoka and Reki Reki have both served as divisional hospitals in the past. So it is within our means to be able to provide backup if we have to close Lautoka Hospital.
Dr. Fong, for areas in the west and in the lockdown areas, do they have access to essential items? I'm not talking just about food only, but medicine, medical care. What sort of arrangement is there for them?
No, essential travel is allowed. Well, the containment area have the same conditions as we're doing right now in Suva, and where essential travel you can move. Shops are open, food is accessible, all those things. It's not on it's not the same lockdown as we had over the weekend.
So I meant communities such as Nasomo in Vatukola, where they're not allowed to travel.
Yes. Oh, sorry, I didn't get that one. Yeah. You're absolutely right. We actually have to mobilize a lot more to them. We are, I know that the whole of today we were talking about it, moving up some supplies across, because now we've got a contingent of 70 or so extra personnel have gone across. I think that's what CMA was talking about. They're going to help in the containment program, and for us the containment program is to screen, contain, and also sort out the containment logistics for everybody. So yeah, it's always in our mind. It's always in our mind. Yeah.
One more question.
Dr. Fong, some supermarkets are still seeing not following proper guidelines, COVID-19 guidelines, like not following social distancing and keeping the 50% capacity inside the supermarket. The message was clearly given that those businesses that do not follow guidelines can be shut down. Will this be done now, as this can be the next super spreader event?
Yes, we will have to come down more firmly on that. I've seen the pictures that you're talking about. We've tried the soft approach to keep reminding people to please maintain your... There's a couple of areas, especially in some of our crowded areas where the supermarket is selling to a lot of crowded people, that we will probably now have to get people to go and patrol it regularly and sort out the distancing. And if it doesn't happen, then we'll just have to close it down. But your point is taken. It is your concern is our concern. It is something that we have to sort out.
So just one more question.
Oi.
Dr. Fong, what happens to contacts of positive individuals after they've served their 14-day home quarantine? Are they discharged, or do you have them go through another, just extend that time of quarantine just out of safety?
Or the secondary contacts, eh? Yeah, you know what? You know, I've tried to explain before. If I'm a contact, if I had COVID-19, my colleagues over here will become primary contacts. Their contacts will become secondary contacts. If one of them is tested positive, then their secondary contacts will become primary contacts. So they stay for 14 days, and then the contacts of the secondary contacts will become secondary contacts. So you get how this thing keeps moving. So every time you are defined as a primary contact, yes, you stay for 14 days.
Dr. Fong, just a clarification. You mentioned that the two doctors had 98 close contact. Will you be able to disclose if some of these close contacts are also patient at the Lautoka Hospital?
As I said, we've actually got a few patients that we have to put in. We're not saying they're positive, remember this, eh? We're saying they're contacts. That means we are going to test them to see whether they're positive. Okay? That's the whole point of a quarantine. The quarantine doesn't pull out a person with a disease. It pulls out a person at risk of the disease. So I just need you to be very clear on that. So yes, if it is a patient that is a contact, they will also be quarantined. I mentioned that also in the speech.
Thank you very much, Dr. Fong. Thank you, members.